Dr. Buzz,
Yep.
what is PRP?
Platelet-rich plasma. That's a good one. So, PRP is a treatment that we use in the facilities that can help the body heal quicker. Kind of the easiest way to explain it to patients is it's kind of like fertilizer that you can inject or use a needle to put into an area that helps areas heal better. Basically, what you do is there's a huge difference in PRPs. There's definitely it's used very loosely, but what most doctors are doing really isn't PRP, which is platelet-rich plasma. It's platelet poor plasma, and there's a big difference, and that's just the concentration of platelets because the platelets are the food or the growth factors that help things heal or make things more anabolic. But to get a concentration that really works, you need to take more blood.
Mhm.
And the vast majority of doctors, I talk to doctors all day long, every day. Most people who are doing PRP are simply taking a 10 ml tube of blood or 20 mLs of blood, spinning it one time, and calling it PRP. If you take the blood or that little bit of blood and only spin it one time, that's really platelet poor plasma by definition. Platelet rich plasma has to be at least 3x concentration. If you spin it one time, you can't get past 1.7 concentration. So that's the problem. And you'll talk to a lot of patients and say, "Have you tried PRP?" And they'll say, "Yeah, I went to another doctor, did it didn't work for me." First question I'll ask you is, how much blood did they draw? And if they say one or two tubes, I know that wasn't platelet rich plasma because you just can't get a concentration doing one or two tubes. So really, what the research shows is to get to, you really want to get to between like 9 and 12 billion platelets in an area to help it to heal. But to get there, you need 60 mLs of blood because there's only so many platelets per ml of blood. So, like with our kits, you draw 60 mLs of blood, you spin that down. Another thing that's very important is how you get the blood out of the person because platelets can get damaged if you pull out blood too quickly. So we actually have proprietary tubes that were actually originally designed for pediatric use, but they pull the blood out slower because you have to be very gentle in the way you pull the blood out of the body. Because if you pull it too quick, you can rupture the platelets, which you don't want to do.
Mhm.
So they pull the blood out very gradually, 60 mLs of blood. You spin that one time. You take the Buffy coat where all the platelets are at, and then you spin that a second time, and that takes you from that 1.3 to 1.7 concentration to the 9 to 12 concentration to get you to the 9 to 12 billion platelets. And once you have that, that's a very anabolic agent and very effective in healing like tendinopathies, helping cartilage grow back, healing muscle tears, used for aesthetic use. Um, but one other trick that people can use with PRP is what people also have to understand is if you're injecting a liquid into someone, whether it's PRP, A2M, Wharton's jelly, exosomes, if you inject a liquid into an area, it dissipates or clears from that area within a few hours or a day. So you get an effect from it, but the effect doesn't last that long. So the other thing I always recommend when anyone using PRP or A2M or any of these other biologics is also using scaffolding. And scaffolding is like a gel-like material that you can make with our PRP kit. You just take some of the platelet poor plasma that's left over, you heat it up, which changes the conformation of the protein and makes a gel. But that gel is very robust. And then you mix that gel with the platelet-rich plasma that you made, and you inject that gel infused with PRP, and that lasts in the area, whether you inject it for a joint or in a face or wherever, for a couple months.
Mm.
So it's more of a time release. So that prevents you from having to doing multiple injections. So, I know we covered a lot there. To keep things simple, PRP is fertilizer to take an area that's catabolic, that's not healing, and make it more anabolic. But not all our PRP is the same. It's very important how you draw it out. You have to draw it out slow, so make sure you're using low pressure tubes to draw it out. We also only use sodium heparin with ours because the anticoagulant also has a lot to do with the platelets and the viability of them. Sodium heparin is proven to be the best. That's what we use for our anticoagulant. And you got to draw enough blood. If you're not drawing at least 60 mLs of blood, you're not going to have platelet rich plasma. You're going to have platelet poor plasma.
Okay, and does insurance pay for the procedure?
Insurance, it's covered by some auto cases. Most major medical insurances at this point do not cover platelet rich plasma therapy. And I always explain to people all insurance works the same way. They look at platelet rich plasma as something that is a wellness or helps you heal, but it's not emergency medicine. And all insurance works the same way. If someone has car insurance, will they replace the tires on your car? Do they pay to have you wax your car? The answer is no,
Mhm.
because that's to upkeep it and maintain it. But if you get shot by a gun, then it's covered. That's an emergency. So
Right.
when you need a joint replacement, that's an emergency. You've waited too long. So typically therapies like, whether it's Wharton's jelly, A2M, PRP is not covered by insurance.
What is ozone?
Yeah, ozone. So oxygen is O2, which is two oxygen molecules. Ozone's O3, so it's 50% stronger. But I think the reason we're talking about today is how can you use ozone in a regenerative medicine practice, or how it's helping people heal. And ozone is a very powerful healing agent because what you have to understand is the areas that don't heal on people, typically joint spaces, tendon spaces, especially as we get older, have poor circulation. Poor circulation means poor oxygen supply. And your own stem cells need to have oxygen to release their growth factors to heal you. So you can't inject oxygen because oxygen also has nitrogen, which can cause an embolism. So that's not an option. But ozone, when you make ozone in an ozone unit, you remove the nitrogen and you add another oxygen molecule, which is O3. So very safe to inject. And when you put that in there, that ozone molecule is very unstable, so it immediately oxidizes the area. So it's like CPR for your cells. So ozone's very effective in treating tendinopathies, can help with muscle tears. It's good for a lot of different things. It's so but the main thing with ozone is it's very safe to use. And just think of it CPR for your cells. It's a way to get oxygen to an area of your body so your own stem cells can help it heal better.
What is NAD plus?
Oh, NAD plus, that's all the rage right now. So to keep things very simple, NAD plus is the coenzyme that makes your mitochondria or your Krebs cycle work. So this is going to go back to chemistry in high school. You probably remember in chemistry there was this thing called the Krebs cycle you had to memorize, which was terrible. But to keep it things really simple, the Krebs cycle is how your body takes fat, carbohydrates, and proteins and converts it into energy or ATP.
Mhm.
NAD is the molecule that makes that whole thing work. And if you don't have enough NAD, the Krebs cycle slows down, which slows down your metabolism and makes you not able to produce energy. Now, unfortunately, as we age, by the time you're 40, you have about half the NAD levels you had when you were younger. So that's why your metabolism slows down when you get older. And that's why you get brain fog when you get older. So it leads to a lot of other issues. So you have to supplement with it if you want to feel younger and have those same benefits you have when you're younger to get the mitochondria to work better. And where are the mitochondria? Every cell in your body has mitochondria. Every single cell, from your skin cells, your hair cells, your heart cells. So all the cells in your body need this. And people ask, well, so who needs it? Everyone that has cells. So everyone
Mhm.
who's alive. The problem, though, is NAD is not orally bioavailable. You can't take it liposomally. You can't shoot it up your nose. So really, you're delegated if you want to improve your NAD levels. You either have to inject it, do an IV, or use iontophoresis. The problem with injections is it has such a strong effect on mitochondria that you have to do a very small dose, and you really can't get the dose effect you need to have a result. So
Mhm.
injections really don't work unless you're really going to inject yourself 4 or 5 times a day. It also has a short half life, about an hour. You can do an IV, and those will become very popular, but the same problem's going to lie. Now, with that, you can do 500 milligrams, which is a good dose, but you have to do it very slow. So it's a 3 to 4 hour IV, because if you try to go faster, that strong effect has on the mitochondria can cause you to have chest pain, discomfort, nausea, lots of other things because it's speeding up your metabolism so much. So that's where iontophoresis comes in. And iontophoresis, just to refresh everyone's memory, is uses electrical energy to push molecules through the dermis of your skin directly into your bloodstream. So think of an IV without a needle. And if you really want to have better effects with it, we always recommend using a microneedle device on top of it first, which creates microchannels. Then you have the electric energy of the iontophoresis patch pushing the Na directly into your bloodstream. But it accomplishes two things. Number one, it's comfortable. You just wear a patch. Number two, being we talked about earlier, NAD has a short half life, about an hour. So it allows you to take that 1,300 milligrams, but dose it over 12 hours. So your dosing, or your TUD, or time under dose, is 12 hours plus. So a much better effect than an IV or injection.
Mhm.
And what do you feel with it? Everyone has more energy, better mental clarity. You have brain fog, you got to try NAD. If you're an athletic type person, it increases cardiovascular ability, at least 10% in most people. So, like, I like to wear it when I work out. But it kind of improves everything. Pulse ox improves, inflammatory markers decrease. Like, we do a lot of CRP testing here, which is an inflammatory marker, and the results we get are crazy. But how's this all work? Well, because it just makes your cells work more efficiently.
It's like a sexy anti-aging secret.
I mean, it's one of the few supplements that you can take. Like I take a lot of vitamins. I'm sure most people that listen to this take a lot of vitamins, but I don't like CoQ10, B vitamins. But if I miss a day or two, I don't notice it. When your NAD levels are down and you bring them back, you feel it.
Mm-hmm.
Noticeably more energy, noticeably more cognition. I sleep better. So it's a stimulant, but it's not like coffee or Adderall because you actually improves your circadian rhythm and helps you sleep better too. So
Yeah,
everyone's got to try it at least once, in my opinion.
I agree. All right. That's awesome. Dr. Buzz, what is BPC 157?
BPC 157 is a peptide. And just to refresh everyone's memory, peptides are just small chains of amino acids, and they're signaling molecules. Like another example of a signaling molecule is insulin's also a peptide. But what's cool about peptides is they signal very specific tasks. They don't interact with a bunch of other stuff. They don't meddle with other stuff. So like with insulin, for example, if you eat sugar, your body would release this peptide called insulin, and it specifically tells your cells to absorb the sugar out of the bloodstream. Doesn't do anything else. That's great. BPC is a peptide that works on several different mechanisms. The first thing it does is it modulates cytokines, which are the molecules that cause pain. So when you take BPC, it decreases pain. It also functions especially if you put like an iontophoresis patch or inject a certain area, it can cause angiogenesis, which is more blood vessel formation, which increases circulation, which helps areas heal because the areas that don't heal have poor circulation.
Mm-hmm.
So anytime you can stimulate blood flow to an area, it's going to help the area heal better, on top of modulating the cytokines, which are causing the pain. It's also amazing as far as it helps with like anyone that has colitis, Crohn's disease, any inflammatory gut conditions, because it does a really good job of healing the mucous membrane of the gut.
Diverticulitis.
Diver to any gut inflammatory condition, when you
Mm.
put someone on BPC, there's significant changes. So it really helps the gut integrity and the gut lining, which is very important. Even people that have autoimmune type conditions with leaky gut, BPC is like a cheat code because it really just helps that mucosal lining become thicker and more vibrant.
What is glutathione?
Glutathione is often known as a master antioxidant. It's the strongest, agent we know to help decrease oxidative stress. What's oxidative stress? Well, oxidative stress is what damages your cells and your DNA, which can ultimately lead to cancer and lots of other conditions. How do we get it? Well, our environment, BPA, sunlight. There's lots of things that cause oxidative stress, chemicals in the environment. So the best way to decrease oxidative stress, or the best compound known, is glutathione. Now, glutathione, you can take it orally, although it's very poorly absorbed. So the best way to get glutathione is either with injection or iontophoresis or IV. But glutathione also has a very short half-life, 10 to 15 minutes. So if you're injecting your IV, although it's a very strong antioxidant, it doesn't last in your system that long. That's why we like to use it with iontophoresis, because the iontophoresis patches allows you to dose a large bolus dose of glutathione over 12 to 14 hours.
Hmm.
So you're basically basking your cells in this very powerful antioxidant that goes systemically through your body. And once you decrease oxidative stress, you decrease DNA, telomere damage, all these different things that actually lead to aging and cancer and all these other type of things. So everyone should do glutathione at least once a week, in my opinion.
And to be clear, just for the audience to know or whoever's listening, when you take it orally, and I want people to understand why it's not orally available, even though there's things on the market that say you can take it orally. I want them to understand what happens when you take a pill orally and it goes down into the stomach.
Well, the stomach has very powerful acids to break things down. So a lot of these molecules and peptides, you can take them orally, but they're not well absorbed because they get broken down in the gut.
Right.
So, and really, they don't get to the small and large intestine where they go out into the systemic system. So, you may get, I think like BPC 157 absorption rate is less than 10%.
Mm-hmm.
Glutathione is also a very low absorption rate. And I know there's like liposomal formulas out there and these other things. And you probably do get some, but nothing's going to be as good as putting it directly into your bloodstream.
Right. What is KPV?
KPV is a peptide that's very well known to help people with autoimmune type conditions. Uh, it's very anti-inflammatory, but what's unique about the KPV as a peptide, which is basically just a small chain of amino acids, is it signals to, it really focuses on the autoimmune related cytokines and inflammatory markers. You know, like nuclear kappa alpha is this inflammatory marker that people have autoimmune conditions gets turned on. It's literally like a light switch. And KPV literally is like going in there and it shuts off the switch. So anyone who has autoimmune conditions and all the inflammatory conditions and issues with inflammation, taking KPV is like going in there with a big hose of water and just like shuts all the inflammation down. So it's amazing for anyone with any autoimmune related inflammatory or conditions or issues.
And they're using that your recommendation is on the iontophoresis patch as well.
Yeah, KPV, you know, like just like a lot of other peptides, not orally bioavailable. Remember, peptides are just short chains of amino acids. Once they hit the stomach acid, they're broken down, so there's really no oral bioavailability. The other problem with peptides is they have very short half lives. KPV's half life is less than 15 minutes. So if you were going to inject it, you'd have to inject yourself 5, 6 times a day to make sure you got the maximum benefit.
Mm-hmm.
Where if you can wear the iontophoresis patch, which uses electrical energy to push it directly into your bloodstream so you have a systemic effect, you can dose yourself over 12 hours. So think for 12 hours, the cells in your body are getting the signaling molecule to shut off the nuclear kappa alpha inflammatory marker and just shutting that inflammation down for 12 hours and get you ahead of the head of all the discomfort and everything associated with autoimmune.
What is bio-scaffolding?
So scaffolding is something that can be either derived when you make PRP or A2M. You can basically make that out of the platelet poor plasma that you have left over, or in the biologic space, it can be made from a derivative. Umbilical cord extract is another way that you can make it. But scaffolding is very important, especially if you're using any of these kind of things in an orthopedic practice, because what you have to understand is if you're injecting a liquid, whether it's an exosome product, a Wharton's jelly product, PRP, A2M, and you just inject the straight liquid into an area, that liquid clears out of the area very quickly. You know, maybe an hour or two to, if you're lucky, 24 hours. So, like, you're going to get the effect for a little bit of time, but you don't get it for a lot of times. It just clears out of the joint or clears out of like where the muscle tears out, or even like a P shot or O shot. It clears out pretty quickly. Scaffolding is more robust. It's like a gel. And if you mix exosomes, Wharton's jelly, PRP, A2M in a gel form, then that gel form still goes through a 27 gauge needle, but it adds, basically it's like a motherboard. It holds the thing in place. And that scaffolding will hold, when it's mixed with these other things, will last 2 to 4 months. So that prevents you from having to do repeat procedures. So think of it. So instead of getting the benefit of PRP for 2 or 3 hours when you inject an elbow, what if you can hold that PRP in place and have it there for a couple months?
Yeah.
A much better, it's kind of like a China doll. Slowly over time, it breaks down, releases more of the platelets, more of the growth factors. So obviously, that's a much better effect.
How does the iontophoresis patch work?
Okay. Yeah. So iontophoresis is a technology that's been around since the 70s. And basically, it uses electrical energy or charge to push molecules, basically from a pad directly through the dermis of your skin and directly into your bloodstream. So think of it as an IV or a shot without a needle.
Mm.
Um, the efficacy of it can be increased if you use a microneedling device before you do it. So it's simply that, if I was going to put the pad right here, like microneedle over it, that would create microchannels. And once again, the electric energy, the best way is electric energy is probably the wrong term. It's kind of like if you take a magnet and you have two negative sides and you push them against each other, what's going to happen? It's going to push through. So
Mm-hmm.
it drives this through your dermis. Because if you just rub like NAD or BPC 157 on your skin, it's not going to absorb, right?
Right.
So you have to have a driver, and that driver could be using a needle, or you can use iontophoresis. Now, I will say when you use iontophoresis that sometimes you can get a red mark afterwards, but you do have to remember it's pushing that molecule directly through your dermis into the skin. It's actually working, right?
Mm-hmm.
So sometimes you can get a little bit of a red mark there, but if you use, if that happens to you, number one, I'd say the main way to avoid that is when you wear the patch, don't wear it for 24 hours. They're designed for 12 or 14. Wear it the amount of time you're supposed to use it. Make sure it's tight on the area, but not too tight. Like, if you're wearing like skinny jeans or
Really tight
really
clothing
tight clothing, it can start rubbing. And remember, there's electrical energy there, so that can cause irritation,
can cause a burn.
can cause a burn. So I usually recommend wearing it on an area, like it'd be fine on my shirt, but I wouldn't wear it on my butt and sit on my butt all day long because that rubbing could cause burning because there is electric energy involved with that. And if you do have a red mark when you take it off, usually it's like a little bit of 1% over the counter hydrocortisone cream. Just put it on there right afterwards.
Yep.
That handles it.
Can patients go and purchase the iontophoresis patch on their own?
No, unfortunately, iontophoresis patches are medical devices that do require a prescription. Now, chiropractors can prescribe them, physical therapists, podiatrists, medical doctors, DOs. Most medical providers can prescribe these, but they're not available over the counter. So if someone's buying a patch on Amazon or online somewhere without a prescription, most likely it's just a band-aid with some type of peptide or something on it. And unfortunately, these peptides, BPC, NAD, that you can't just put a band-aid over it and put on your skin and expect it to go through. It does need to have a driver.
Hmm.
So that's why you need the medical device. And those have their own microprocessor, their own battery, but they are prescription only. But the good news is more and more providers are accepting this technology, and at this point they're in all 50 states.
If someone has arthritis, how would you treat it?
Yeah, I mean the first question you have to have for the patient is, do you want to save the joint or eventually do you want to replace it? Because if you have arthritis, it's progressive in nature and never gets better on its own; it only gets worse. And that's because of the mechanism of action. If you have arthritis, basically what's happened is either due to overuse trauma or post surgery, your body has released these proteases or little proteins in the joint to clean up damage. But as we get older, we'll say past 30 to 35 years of age, your joints become avascular and these proteins become trapped in the joint. So think of them as termites in there, and they start to eat away at the joint, and that's the cause of arthritis. And if you don't get rid of the termites, eventually the joint's going to be gone. Now, unfortunately, traditional medicine, the way they treat this is a lot of people would do over the counter like NSAIDs.
Hmm.
Now, that's like a very common, but the problem with NSAIDs is it does nothing to get rid of the proteases. And they work on this pathway called the COX2 pathway, which actually inhibits cartilage growth. So if you have termites in there eating away at your cartilage and you're slowing down cartilage growth, what do you think the NSAIDs are going to do long term? Actually speed the process up.
Hmm.
Another typical medical treatment would be like a corticosteroid or steroid injection. But once again, although it's a very potent anti inflammatory, they also speed up cartilage degradation. That's why you're only allowed to get 2 shots per joint per year because every shot can cause up to 7% bone and mineral loss. So if you get 2 cortisone shots a year, that's 14% loss on top of the termites eating it. So if you're going that route, you're just saying, I want to replace the joint, which is a choice. But obviously, an artificial joint's never going to be good as what God gave you if you can save your own joint. So a more logical approach for the patient that wants to save the joint, and if they haven't gone too far, is to basically do a structured program. And step one is you got to get rid of the termites. And the only way to do that is to use A2M, which is alpha 2 macroglobulin. And basically, that's a product that a physician can make from your own blood. Um, A2M is actually a circulating protein in your bloodstream. It's the largest protein in your venous system, but it's so large it can't get into your joints. What a physician can do is they can take your blood and filter it down and capture that specific protein, that alpha 2 macroglobulin protein, and then use a needle and put it into the joint. And when you put it into the joint, it breaks down the proteases in the joint. It's like bug spray, it gets rid of them.
Hmm.
So you get rid of the cause of the arthritis. And then usually what I would do in between time, because there's 2 parts to this, because we're going to do something to help the tissue grow back on the backside. But you have to wait 6 weeks. So you got to prepare the joint for 6 weeks. So you're going to put the A2M in there with some scaffolding, and it's going to sit there for the next 6 weeks and just get rid of all the proteases in the joint, prepare the joint, and get it ready for the next step. I would also, in the meantime, use BPC 157 combined with NAD and GHKCU. These are all peptides that promote angiogenesis or circulation. They modulate the cytokines, which help get rid of pain. GHKCU is also very good for cartilage growth. So that combination via iontophoresis, you wear that patch 12 hours a day on the joint you're treating. So you're bathing that joint with everything it needs to get rid of the inflammatory cytokines, to increase circulation there, and help grow back cartilage. So making it very anabolic. And then after 6 weeks, I would either do a double spin PRP, not single spin, double spin PRP, or potentially like a Wharton's jelly allograft or exosomes. Like they all kind of work the same way. That's really the provider's preference. But what that does is, you picture this, it's kind of like the garden analogy. So you had termites in your garden eating your tomatoes or flowers. I don't, termites probably don't eat flowers, but
No, probably not.
we'll say beetles.
They eat the
eating your
trees.
flowers.
Hmm.
So step one is you kill the beetles. Step two is then you basically the BPC patches with NAD and GHKCU is kind of prepare the soil, like kind of till it up a little bit. And then step three is now we're going to put fertilizer in there so they grow back. So that's how that three-pronged approach, the A2M first, BPC, NAD, GHKCU to get the soil more ready. And then let's add the fertilizer so things grow back, whether it's Wharton's jelly extract, exosomes, or double spin PRP to help things grow back quicker. That's a true way to fix a joint long term. And people ask, well, how long does that last? What should last as long as you last? Because if you're growing back tissue and you got rid of the cause of the arthritis, you're not going to have to go have any more treatments in the future.
Tell us how others can look like you.
Have a wife that cooks you food good.
Okay, no, seriously. Tell us.
um, I think working out consistently, but it doesn't have to be, like do something every day. I think you
Mhm.
have to be consistent.
Just move
Um,
your body, right?
Move, whether it's walking for 30 minutes, I know we like to ruck, like wear backpacks, but you don't have to do that, play pickleball, do something. But I do think you need to move every day. I think it's important to make sure your protein intake's good. So a lot of people don't monitor their protein. So I would say at least half your body weight in grams of protein. So if you weigh 200 pounds, at least 100 grams a day, spread out throughout the day. If you don't like meats and fish and vegetables, you can always do like amino acids or something like that. There's some good products on the market. I think really don't eat carbohydrates like 4 or 5 hours before bed. Not only will you sleep better, but when you eat those carbohydrates before bed, if you don't eat them, they turn to fat. So if you're trying to lose fat, I think it's very important. I think intermittent fasting is also very important. Not only is it good for your health, but it gives your body the ability to learn how to burn fat. If you're eating all the time, your body never burns fat and it kind of forgets. So, I try to do at least a 16-hour fast at least 2 days a week. So if you're fasting that long, which is not that hard because you sleep 8 hours, so it's another 8 hours, so it's not that big a deal. But when you're not eating for 16 hours, your body is forced to burn body fat.
Hmm.
So it becomes very efficient at it. So, I think fasting is another very important thing. And on those days that you fast, you actually have more energy anyway. So fasting is not that hard. And usually I tell people, well, I'm starving. Well, usually if you're hungry, it's probably just you're thirsty. So during your fast, you can have water, you can have black coffee with stevia, you can have green tea with stevia. But from my experience, when I'm hungry, it's just I'm thirsty.
Wow, that's interesting. Okay. And what else? Do you think supplements are important?
I think supplements are important, but I think it's important to, really, now you're going to go down to the three body systems, your neuroendocrine, GI, and your detox systems. Um, if your adrenals are messed up and your cortisol levels high, you're not losing weight. I don't care what you do.
Hmm.
There's a lot of people at the gym that are not in shape, and they probably have really high cortisol levels because when your cortisol levels high, you're puffy.
Hmm.
So I think getting an adrenal test is very important. I also think your gut health is very important. They've done studies where they'll take, mice that are fat and they'll import the microbiome of a skinny mouse into their gut, and all of a sudden the mouse will get skinny. They'll do the same thing. They'll take the skinny mouse and put the microbiome of the fat mouse into the skinny mouse, and he gets fat. So a lot of people who struggle with weight, it's because your microbiome's messed up, and it doesn't matter. And you see a lot of heavy people that they go to Orange Theory every day. They
They
only eat
barely
fruits and
eat.
vegetables, and they're still heavy. It's
Hmm.
either your adrenals are messed up, your cortisol levels high all the time, or you have something wrong with your microbiome. And what's sad is those are very easy to fix.
Right.
But traditional medicine doesn't test those things. But those are tests that we send to people's house. One's a spit test, one you poop in a little box and send it in. You don't even do it at the doctor's office. And those two tests there is really the key to people's metabolism, especially people that struggle.
Yeah. So that's really what I was trying to get at here. So if someone is looking, because I get it too, how do I look like you? You get it all the time. Like, how old are you? And then how can I look like you? Right? How can I be as big as you? How do I get these muscles? And number one, you've played sports in high school, right? Or college. You worked out for a really, really long time, strength training. Yeah. You've always ate good foods. You've always taken care of yourself. I think sleep's important. Taking supplements, the right supplements. I don't
Yep.
think all supplements are necessary. When you live in
Most people probably take
Ohio,
too many supplements, in my opinion,
yeah,
but
it
that's a
is.
separate conversation.
Yeah, right. If you live in Ohio, this year we haven't seen much sun. So
We get
that's
it whenever we can, but
we get it
yeah,
when we
getting
can.
outside.
Sleep is super important, right?
Yep.
And then also just like eating the good foods, and that's really what it is. But then also doing things health wise to take care of yourself. I think once you hit a certain age, hormone replacement therapy is very important, which is another conversation. But because of the world we live in, it's super important, right?
Yeah, I mean, I would say everyone should at least do an adrenal test and
Yeah.
a gut test, even before you do a hormone test, because you have people that take bioidentical hormones, but if your adrenals are messed up and your cortisol is high, it's going to be like the puffy guy at the gym.
Oh yeah.
You know what I'm saying?
Mhm.
So like you got to have those cortisol levels under control, because what you have to understand is not only make you puffy, it causes inflammation of your blood vessels and your arteries. Can lead there's lots of bad downstream effects. It affects sleep pattern. It messes up your gut, which can lead to cognitive decline.
Yep.
Those two systems, your neuroendocrine and GI system, are very intimately attached to each other. Um, and especially as you get older, you want those things functioning at 100%.
Okay. Yeah, so I guess before anything, those two tests are super important. So, if you're always wondering, or if you know Dr. Buzz, or if you see him out and you're like, wow, how'd that guy get that big? I want to be that big.
You're a good cook too.
I am a good cook. Then basically get those two tests and then just start moving somewhere, right?
30
Movement.
minutes a day, do something.
Just do something with yourself. All right. Awesome. Thanks for sharing that.
Yep. Thank you.
Okay.